Okay, aloha, goat and sheep. Moving on with issues related to after lambing care. Okay, so we have a phenomenon called entropion, where one eyelid, usually the lower one, is essentially stuck, folded inward into the eye, where the eyelashes are then coming into contact with the cornea and eyeball. Is a heritable trait, i.e., one that should be noticed and culled for, right? That can cause some pretty substantial problems, right? It can lead to infections, which can lead to essentially total blindness. Okay, comes up the first few days of life, and the eye that'll be going, and if it can be one or two eyes, right? Generally, the bottom lid of either one or two going to be watery, squinty, really not normal. Pretty easy to notice. Okay, and so we have a few methods of getting to that. Here we have instances of a poor little blind lamb, which is too bad. And this man who uses a bell so the lamb can know when he's coming. That's very nice. Very nice. But we have methods of treatment that include both surgical and just topical treatments. Okay, so initially we just apply a topical antibiotic to make sure that no infections are going on in there. And then we want to put that on regularly, get some visuals on the animal regularly, actually do some physical, just kind of massaging and moving, manipulating the lower or the affected eyelids a little to see if it'll begin to dislodge out of there. Sometimes it can just dislodge. One surgical means to put in 1 little cc, a little milliliter of penicillin just under the skin of the lower eyelid, which then has a ballooning effect, right? That can push, right? Physically push the eyelid that's inverted out back again. And then once it's popped out, okay, it ought to stay that way, right? And not resettle back in. Can also put a little clip, a hemostat, okay? Similar to where we tie off some of our umbilical cords, right? You can apply a hemostat just below the eye, where the skin right outside of the eyelid that's affected, or if you don't have a hemostat, you can put a little alligator clip on there, right? And leave it on there in a day or two. And in a day or two, you'll start to, again, with slow and adequate pressure, start to put that eyelid to pry it back out, encourage it back out of there. It's important. I want to emphasize again here that, you know, if you're doing this with these animals, you're going to want to definitely not retain these animals as breeding stock, and you're going to want to, sadly, fault their mother a couple of points for this, right? If it comes up twice, that's definitely a no-go, right? Okay, we also have eye clips. Little wound clips, essentially, that we can, with a little handheld little trigger, we can clip them on there, which essentially does the same thing, okay? Laid horizontal on the lower eyelid and pinched together using forceps that does the same thing, just applies pressure that'll then can stay on there for a few days as the eyelid gets sorted out. Produce a clip in this instance, produces a fold of skin, prevents the eyelid from rolling inwards, right? And getting back into that into that state. And then 2 weeks later or so, the clips are start falling out of there. As I mentioned, you want to cull these animals because, again, hopefully, I think I've mentioned themes, right? In animal husbandry are themes. Okay, we want to touch these animals as few times as possible. Okay, we're gonna have to be freaking using our time to build fence, as you all know. Okay, and cutting trees, obviously, and power washing the facilities. Okay, we got to be doing all that. So we don't want to be out there, right, having to wonder if our eye clips have fallen out yet, right? We want to not worry about eye clips, okay? So we want to be very active, especially with our small ruminants, on culling, okay? Mahalo, you all. I hope you're staying healthy and well. I'll see you in lab tomorrow, 12:30. I'll put La Lima addresses up. Mahalo.